This is from the Atlanta Journal-Constitution in Georgia today. Quote, on March 2nd, a month before Georgia Governor Brian Kemp issued a statewide stay-at-home order, two top state officials received a warning about the dangers posed by people who did not display symptoms of the coronavirus. A professor at Georgia Tech who advises governments on how to deal with public health catastrophes sent this email to senior members of Brian Kemp's administration way back on March 2nd. It said in part, quote, there is a strong chance that a person could be infected but asymptomatic, but could still infect others. That was received by Georgia's public health commissioner and the director of Georgia's emergency management agency a month ago, explicitly giving them an early heads up about how people who are asymptomatic can nevertheless still have the virus and still spread it to other people. Again, that was March 2nd, more than a month ago. This, however, was the governor of Georgia talking about the recent revelation he just had about the asymptomatic spread of coronavirus 2 days ago.
The CDC has announced that individuals can be infected and begin to spread coronavirus earlier than previously thought, even if they have no symptoms. From a public health standpoint, this is a revelation and a game changer. Those individuals could have been infecting people before they ever felt bad. Well, we didn't know that until the last 24 hours.
We didn't know that until the last... Who knew that? Between March 2nd and Wednesday, when the governor was speaking there, Georgia went without a statewide stay-at-home order all that time, while the number of coronavirus cases and coronavirus deaths rose steeply in Georgia, and while a couple of real public health catastrophes started to take root in that great state. Right now, the AJC reports there are 58 senior care facilities in Georgia that have confirmed coronavirus outbreaks, 58 in the state. The AJC reporting that the outbreaks are so severe in two facilities that those facilities are, quote, struggling to properly function. One of those struggling facilities is in Albany, Georgia, which is a small rural community of about 75,000 people. In that Albany senior care facility, 35 residents have tested positive, 7 have died just since March 15th. Albany, Georgia is facing one of the most acute and deadly coronavirus outbreaks in the whole country, apparently stemming from a couple of funerals attended by a large number of people a few weeks ago. That outbreak in Albany, Georgia has been buckling the moderate little health system in that rural part of that state. That area of southwest Georgia has just one hospital system. It's called Phoebe Putney. That hospital has 38 ICU beds. By Wednesday last week, every single ICU bed was full with coronavirus patients. The staff at that hospital burned through a 6-month stockpile of supplies in less than a week. The head of that hospital system now telling the AJC, quote, what we were not prepared for were the sheer numbers. An ER doctor from that hospital who's on the front lines of one of the most acute coronavirus outbreaks in the country joins us next. Stay with us.